In the U.S., advanced practice providers like CRNAs deliver care where and when needed. Between COVID-19, clinicians retiring or leaving the field, and the rise in aging baby boomers, the demand for safe and high-quality health care is growing. Angie Mund, president of the American Association of Nurse Anesthesiology, and Mr. Tracy Paul Young, regional director of AANA and CEO of YPS Anesthesia, are here to discuss how inconsistent insurance reimbursement rates are compromising patients' access to care. Thank you so much for being with us today. We really appreciate it.
Thank you so much for having us.
Now, how are inconsistent insurance rates compromising patients' access to care?
Just thank you for that background on CRNAs. I just want to emphasize for your viewers again of how important it is that CRNAs are reimbursed at an equal rate to other anesthesia providers.
Yeah, Lisa, CRNAs provide 50 million anesthetics in the United States each year. Those 50 million anesthetics generate a lot of revenues that helps keep hospitals' doors open and provide the services that they need to the communities that they serve. What we're seeing in the marketplace now is some commercial insurances are decreasing reimbursement to CRNAs solely based on the license to the CRNAs. And that decrease in reimbursement cuts the healthcare dollars going into community hospitals that are there to provide the services to some of the most vulnerable patients out there in America.
Well, okay, so since the laws to end the provider discrimination aren't being enforced, how does that impact CRNAs, medical professionals, facilities, and the hospitals?
I think Tracy said a lot of that really quite well, is that what we do know is in our communities, it's important for us to have a strong hospital. And CRNAs being reimbursed by insurance companies at the 100% of the rate could make a difference between them staying open, decreasing services like obstetrics and pain management, trauma stabilization in our rural communities. What the challenge has been for us is, again, like you mentioned, is laws were passed in 2010. Legislators were all on board that no provider should be discriminated against on the sole basis of their credential. However, during that time, those laws really have not been followed. And in 2020, Congress again went out and asked and said, we need to have rules on this, and asked the Departments of Labor, Treasury, and Health and Human Services to make rules so that there was some enforcement of the intent of the legislation in 2010 to not allow insurance companies to discriminate against a sole anesthesia provider.
Yeah, absolutely. Now, where can our viewers or listeners go for more information?
Lisa, your viewers can go to a new website we just created called accesstocare.aana.com for more information about the topics that we've discussed today in a lot more detail and what they could potentially do to help the situation as well. We in anesthesia, CRNAs, we've often called ourselves the best kept secret in healthcare. What we mean by that is most people don't realize who we are and what we do. Especially when we give good drugs, we knock you out well, and you don't get to remember things from the anesthetic. So we really appreciate the time today to get to discuss who we are and what we do. So thank you.
Yeah, absolutely. We appreciate what you do, too. Thank you for being here with us today and for all the information. We appreciate it.
Thank you so much.
Thank you for having us.